Here I have a tennis ball. This is a trigger point self-release technique that you can do for the upper quarter, perhaps around the shoulder blade or directly on the shoulder blade for some of your posterior rotator cuff muscles. So up against a wall, you want to place that ball, behind that shoulder blade, kind of in the vicinity that you think you're going to have or be working on. And I'm just leaning into the wall. Okay, if you put a little bit of bend in your legs, I'm on an angle, I'm leaning into the wall. I'm then gonna roll, and you wanna be careful and slow because the ball can just kind of shoot off. There's not a whole lot of surface area there, like if you were doing your hip. But you're just going to roll until you find what we call a tender spot or a trigger point where you feel like there is some level of tightness. And I have one like right about there. It just feels a little bit more tender than the other spots, kind of feels like a knot, doesn't feel the greatest. Now, the reason you're doing this up against the wall is to have some control. So once you find that spot, everything is nice and relaxed, and you're just going to keep the pressure onto that spot and try to consciously connect to, okay, I'm going to breathe, and I'm just going to think about letting everything go and just soften as you exhale. And you can stay directly on that spot for perhaps 30 seconds, up to a minute, and then you could find a new spot. So you're not rolling back and forth, you're finding the spot, having pressure that seems appropriate, and then you're allowing that tissue to soften underneath the pressure of the ball.